You may have heard the statement that there is no health without oral health. The health of our mouth is more important than many people realize. Studies have shown that poor oral health leads to cancer, diabetes, heart disease, respiratory diseases, and many, many more. From cavities to gum disease to oral cancer, all of these are painful, sometimes even debilitating, let alone the billions of dollars that are spent on oral health. The question is, what does Medicare do about our oral health? Well, sadly, the answer is very little. But there are some things that you can do to be proactive and protect your own oral health, and that's the topic of this video. I want to focus on four main issues in regards to this topic about dental and Medicare. Issue number one is this. Dental services, notice this, that are not covered by Medicare. And you're going to see this is the majority of services that people need. But let's look at those. These are actually the top 10 services. Number one would be dental exams. Medicare doesn't cover it. You can see if you're out of pocket, these on average about $100 to $175. Secondly, dental cleanings. Again, this is professional cleaning between $100 to $200. Fillings, very simple fillings, $1 to $250. Tooth extractions. Again, if someone were to have a tooth that is going to have to be really surgically removed, meaning it's impacted, this could be as much as $1,000. But that would be a simple tooth extraction. Root canals, just had one myself recently, $1,000 to $1,500. And then bridges, common at times to, of course, bridge a gap. $1,000 to $5,000. Crowns, $1,000 to $1,500. Dentures, and again, this is going to vary. Sometimes people can get same-day dentures, others beyond that, but a $2,000 to $8,000 range. Implants, very popular today, very common, $1,000 to $5,000 per, and then veneers, $1,000 to $2,500. And then it's not also uncommon for people to have some kind of periodontal surgery. You look at the cost of those right now, that's somewhere between $4,000 to $8,000. So this is when people have very serious gum disease and require a periodontal work. So anyways, point is, all these, as you can see, are very, very expensive, and none of these are going to be covered by Medicare. So that takes us into our second issue. Really, a question is this: why Medicare doesn't cover most dental services? Why is it that they're not concerned about these kind of things? Well, number one is this: because of Medicare's inception. In other words, when Medicare was created and designed, which goes back to 1965, what happened was the attitude was that dental care was just not part of medically necessary type of treatment. It just was not in people's mindset really the importance of having dental coverage. So it was not included in that original legislation. So it has not changed. Now we're into this program, almost 60 years, and nothing has changed since 1965 when it comes to dental. Okay, now again, there's been some proposed legislation, but it's never passed so far. So since inception, it's not covered dental, so it's still not. Now, why is that? Well, this is the primary reason. It's just simply because of the cost. Right now, as we get into 2024, the Medicare program is going to cost about $1 trillion. A tremendous amount of money. I think right now somewhere about 12 to 13% of the entire federal budget is going just to Medicare. You put Medicaid on top of that, almost the same amount. And so you can see it's very, very expensive already. And so there's people that already have a problem with the cost of Medicare, and doesn't include dental. Now they say right now the average spending in dental in our country is about $150 billion. And so you, again, if they were to add this to Medicare, now we're probably talking about adding another 10 to 15% more onto the cost of Medicare. They say right now that the average person that doesn't have dental insurance average is spending about $1,000 a year. So again, if that would begin to be covered by Medicare, you can see how that would possibly even overwhelm the budget for that. So that's the primary reason, just simply because of the cost, but also because of the complications of adding an entire program to the world of Medicare. Because think about it, you'd have to decide what dentists are going to take it, what dentists won't, what's going to be covered. Is it just going to be preventive? Is it going to be other comprehensive type of things? So there's a lot that would go into initiating some type of a dental program to go along with Medicare. Okay, so that really is the issue. Another interesting issue with this, when it comes to dentists that would take it, if we were to compare that to Medicaid, right now only 1 out of every 3 dentists even participates in the Medicaid program. Why? Because they don't get paid enough. And so would we deal with the same issue, even if Medicare were to add it, what's the coverage going to look like, but then how many dentists are going to even participate in that program. All right, so again, that's why this can just keeps getting kicked down the road because of the cost and the complications of adding that to Medicare. All right, that brings us then to issue number 3, and that is, what are the dental services that may be covered by Medicare? And again, I want to really report to you, I thought this is really the best way to make sure we're clear in what Medicare may cover. And because there are a couple things in which they would, but it's very, as you'll see here in just a minute, it's very serious situation where Medicare will cover. And first off, if it's inpatient dental, let me actually read this to you. Here's what they say. They say certain dental services you get when you're admitted as a hospital inpatient for your dental procedure. It means you're admitted to the hospital. And if there has to be some dental work that requires this inpatient stay, then Medicare may participate in covering that. It goes on to say the reason you're in the hospital is either because of your underlying medical condition or the severity of the dental procedure. In other words, there's just is going to require something as serious as a hospital stay. And again, that does not happen very often, but again, that's something that they may cover. And then secondly, and really more commonly than this one would be this one, and this is whenever whatever dental procedure you're having done, it's because it's also linked to some other medical treatment that's involved. In other words, Medicare says if there's some other underlying issue that we believe it's important to have some dental work or at least some type of exam, then we will cover that, meaning it's linked to some other medically necessary procedures that Medicare has agreed to cover, then they'll cover the dental as well. Let me just read this to you. Here's what they say. Specific inpatient or outpatient dental services directly related to certain covered medical treatments. In these cases, you must get the dental services because it's linked to the success of the medical treatment that you need. And then they give a couple examples. For instance, an oral exam and dental treatment before you get a heart valve replacement or a bone marrow, organ, or kidney transplant. Secondly, a procedure such as a tooth extraction to treat a mouth infection before you get cancer treatment services like chemotherapy. Just one more, treatment for complications you experience while getting head and neck cancer treatment services. So again, you can see very serious, very limited, again tied to something else that is medically necessary or an inpatient stay is required because of the severity of the dental issue. Hey, if you found this video helpful and if you want to see more Medicare information just like it, then go below, right below the video, and you can give us a thumbs up as well as subscribe to our channel. And every time I put a new video, which is about 2 every week, you'll be notified of that video, and others just like you who need this vital information will get it as well. All right, so as you can see, not a lot of help from Medicare when it comes to our oral health. So let's talk about then what are some of the options for dental coverage. Okay, first of all, some people choose to do this, and that's just simply self-pay. You're just out of pocket. And we see this happen a lot with people that have generally, good, healthy teeth. They may get a cleaning a couple times a year, maybe an exam, an x-ray just once a year. And they just say, hey, I'm just going to simply pay out of pocket for those because my dental needs are minimal. All right, but that's one option to self-pay. Number 2, if you have an employer plan, meaning you're still working and you may be covered by that group plan, it may offer some type of a dental package. And normally those are really very good premiums because it's a large group and you get the discounts because of that large group. And I put on here retiree plans because sometimes we see that even retiree plans will continue to extend those health care benefits. I also might add, as we talk about employer plans, we'll have some times when people are going to keep working and they go on Medicare A and B and maybe get a supplemental plan. Because they feel like it's a better option than their work option. And sometimes in that situation, the employer will even let you keep your dental and your vision because those are separate plans. And so I always tell people, hey, if you want dental and vision, see if your present employer will continue to cover you on that, and as well as the retiree plans may also. So again, I'm just saying that could be an option. Number 3, then would be discount programs. Now there's lots of these around. These are really not, I wouldn't call them insurance, but what they will do is put together a network of a dentist that will actually take this particular program and will give you a certain discount, maybe somewhere between 25, 30, maybe 50% off of services if you see a dentist that participates, again, in that discount program. A lot of these discount programs are just added on in a variety of ways to other type of products, but the point is we usually don't even see any kind of a premium associated because they're really not insurance. And again, it's just that discount program. Number 4 would be the dentist office programs. These are pretty commonplace, frankly. There's a lot of dentists who have just come up with their own plan, and they normally charge some type of a monthly premium, but with that you usually get a couple cleanings a year, a set of x-rays and an oral exam once a year, and then again they'll give you discounts on the services that they provide. And so someone that really likes their dentist, and the dentist offers this kind of program, sometimes maybe that dentist doesn't take any other kind of insurance, that really could be a very viable option. All right, number 5 then, and this one is spend the bulk of my time, we'll wrap this video up here, and that would be this: those people who decide to get a Medicare Advantage plan, or they get a supplemental plan, then they can get actually a standalone. And what I'm trying to emphasize here, these are actually insurance plans. And so I'm going to give you the details of how these would work. Right now, about 50% of all people going on Medicare have an Advantage plan, and 40% have supplemental plans. So those people have supplemental plans can then get a standalone dental plan. 10% of all people have nothing but A and B. Certainly if that's all they have, probably not going to have a dental plan either. So I'm going to focus our time as we close out this video on number 5 and number 6 and give you some of the details if you choose to use either one of these options. All right, let's start with the Medicare Advantage. And keep in mind, if you're new to Medicare, when you go on Medicare, you can choose to enroll in A and B, but enroll into an Advantage plan. Those are called C plans or replacement plans. So instead of you being under the management of original Medicare A and B, now you're under the direction of a private health insurance company that's actually replaced A and B, and so you decided to get your medical coverage through that Advantage plans system versus original Medicare, right? So that's the A and B. Now, so let's talk about what an Advantage plan type of dental coverage would look like. And again, it's going to vary, as you'll see. So let's give you some of those details. Number 1, most of the Advantage plans right now, in fact, 2 out of every 3 plan has a 0 premium. You pay Medicare, the Part B premium, this year $174.70 a month, but you typically don't have to have a cost for that Advantage plan as far as being on that insurance. Why? Because you pay copays instead. And so part of that Advantage plan could also include some type of a perk. And these would be gym memberships, sometimes over-the-counter type benefits, and also a dental allowance. Okay, and that's what I mean. And you're going to notice it's going to be typically at a 0 premium. They charge a 0 premium for the insurance plan because you pay copays, and then they also will include some type of a dental benefit or dental allowance, and that's typically a perk added to the Advantage plan at 0 premium. All right, that's just really the most common. But also now we're seeing this becoming more commonplace. Some of the Advantage plans will actually offer you what they call a supplemental benefit. It's above and beyond just the perk. They give you something else. Now with these normally have a premium. They could be as low as $15, as high as maybe $35 or $40 on a monthly basis. But this is someone who wants to enhance that dental allowance they have up here. Maybe up here, this plan may give you, maybe $1,000 to $1,500, and so you can buy an additional benefit of maybe another $1,000 to $1,500, and so people will do that. And again, not all Advantage plans offer this, but I want to mention in the video to make sure you know that sometimes these supplemental benefits are available with certain Advantage plans. Then number 3, let's talk about the coverage with the Advantage plans. All of them are going to have some type of a preventive benefit, which means if they have a perk for dental, it most certainly is going to include some type of preventive benefit. And that would be a couple cleanings a year, maybe x-rays, some type of exam cleanings, those kind of things. And so almost all of them are going to include that. But many of them, and probably even most of them, are also going to offer what's called comprehensive coverage, comprehensive. Now we're getting into our extractions, our root canals. Those types of things are going to be a little bit more on the expensive side. So if you're on an Advantage plan, you always have to look to make sure that your dental add-on includes both of those, because if it's just preventive, not really too much. And there's a few like that, but the majority of them are going to be both of these services. So that's what we mean by the coverage that's going to be involved. Now, what you also have to pay attention to on the Advantage plan is the plan that you're on is, do they require you to go to a network dentist? Hopefully not, because this is where people can run into some complications if that plan says no, you have to go to a certain network of dentists, because you may have a difficulty finding either the dentist you like or one that takes the plan plan. And so I really don't like it whenever they require networks, but again, many will do that. So pay attention to that. And again, your dentist may take the plan, may be in the network, and all is fine, but you want to be sure. Now, some of them actually will allow you to go out of network as well, and that's what we really like, meaning they're saying we don't care where you go on this particular plan, we will still give you the same amount of benefit, all right? And so the point is you want to pay attention to the network. Number 5, when it comes to claims, normally, if you go to an in-network dentist, you probably won't have to file any claims. In other words, they take the plan and they will submit the billing, and you may have a copay or something, but then they'll get really all the financial dealings will be dealt directly with that insurance company. And that's what we like as well. So the point is, most times in-network, you don't have to worry about claims at all. Now, if you got out-of-network, then almost always you're going to have to address the claim. And what most people do is they pay out of pocket, okay? So in other words, the dentist says that's a $250 bill. You actually may have to go ahead and pay out of pocket, but then what you'll do is you'll turn in a form, and it's called a direct medical reimbursement form. And all insurance companies have these. So you fill out a form, very simple to fill out, and then you submit that form with your receipt of services, and then they'll reimburse you up to the plan's limit. All right, and so again, that's one of the issues out of network, but again, not really a big deal because these advantage companies will make sure they settle up with you up to the max. All right, and then number 6, and this is a real big deal. What is the annual benefit on the plan? And I'd say right now the average is what I talked about up here, maybe $1,000 to $1,500 a year, if that could be for preventive and comprehensive. And so we don't see a tremendous amount of money that they're willing to spend on you, but it's still better than nothing. All right, and especially if the premium is going to be 0. So you always want to pay attention to the annual max, and that's going to be a calendar max. Now, there are some plans that could be higher than that $1,000 to $1,500, especially people that are dual eligible for Medicare and Medicaid plans. Those are called dual special needs plans. We'll see those upwards to a few $1,000s. And so always find out what's the maximum allowance on that particular plan, right? So these are the kind of details that you need to pay attention to if you enroll into an Advantage plan. And be sure, if you do, to use that dental allowance. Hey, Medicare can be very confusing. In fact, people make mistakes all the time because of how confusing it is. So what I've done is I've actually created a Medicare, notice this, Essentials Workshop, where you have the opportunity to really learn everything that you need to know about Medicare so that you can make Medicare decisions. There are thousands of people every month that watch this workshop, and we get lots of reviews saying that this is something that really was helpful to them. And so what you can do is down here below in the comments section, you'll see where it says pinned comment. At the very top of those pinned comments is a link. And you click on that link, what we're going to do is we're going to give you free access to this Medicare Essentials Workshop. And we want you to watch it because we don't want you to make any mistakes. All right, that brings us into our last slide, which is really the second way in which the majority of people are going to get some type of dental coverage. And that is if they enroll into what we call a standalone dental plan. This is someone that has usually enrolled in Medicare A and B. They got a supplemental plan to fill in the gaps that Medicare did not cover, and now they have a separate plan. So this is a separate plan, separate premium, sometimes even a separate company that's offering this particular dental plan that's going to be a good fit for you. All right, so how do we decide? What are we looking at when we talk about standalone dental plans? Well, number one, you need to find out, does your dentist participate in the network? Now, I will tell you the majority of the plans are PPOs, which means as long as your dentist, even if the dentist is not identified as a provider in the network, most dentists are going to take these kind of plans. Now, we do meet sometimes dentists that just don't take any kind of insurance, won't file any claims for the insurance at all, so that's always going to be on you. But my point is, if it is a network plan, if it's a PPO, then that plan will let you go to any dentist as long as that dentist agrees to the terms of that particular plan. That's one of the nice things about PPOs, all right? So on standalone dental plans, in fact, I've never seen an HMO plan with that type of coverage. They're typically PPOs, which means go anywhere that will agree to take the plan. Number 3, then we're going to talk about the coverage on standalone dental plans. Now, here's the way most of these plans are structured. Number 1 is this. Most of them are going to give you some type of preventive benefit. Preventive benefit, again, this is your cleanings, x-rays once a year, an exam, usually get a couple cleanings, but that's the preventive aspect. The second part is going to be what we just call basic services. Basic services are your lower cost items we looked at earlier, extractions, fillings, those kinds of things that really don't cost a whole lot. These simple items are typically less than $1,000 in services. So you have basic services, and then you have major. Now we're getting into our root canals, our crowns, implants if the plan is going to cover that. But these, again, are things that are going to be a little bit more expensive, certainly periodontal work and those type of issues. So that's the components of the coverage in every standalone dental plan. Now let's talk about standard and customary. And this is very important because standard and customary means the plan agrees to pay what is standard and customary in that particular region for those particular services. And sometimes a dentist charges higher than that. And so you got to be aware the plan may pay, but if that dentist doesn't agree to take that as payment in full, sometimes you could have an additional bill. Again, it's not, in my opinion, a deal breaker. I think it's still wonderful to have coverage, but just know they normally are going to pay what's standard and customary for your market whenever there's a claim filed. Now, let's talk about monthly premiums. And again, these are going to vary, folks, around the country. But I would say on the average, we're talking somewhere between about $40 to about $50 a month. And this would be per person. So husband and wife, we're talking, somewhere between $80 to $100 for a decent dental plan. All right, now when we talk about the waiting period, this is very important because what happens is that sometimes if someone doesn't have dental insurance in the past, like a group plan, and they pick up one of these plans, occasionally that plan may say, well, because you've had no dental insurance, we're going to have some kind of a waiting period, all right? And that could be a period of time. In fact, we've seen some plans where what they'll do is they will cover you on preventive day one, but when it comes to basic services, they may make you wait 6 months, or on major services, your crowns and root canals and implants, they may make you wait 12 months. That's a waiting period. So always find out, does your plan have a waiting period? Now, sometimes a plan will say, oh, we don't have a waiting period of 6 months or 12 months, but what they can do is they can have a reduced benefit for a certain period of time. So they may say, initially we'll cover the preventive at 100%, but on the basic, we're only going to cover 50%. And then once you've been on plan for 6 months or a year, then we'll cover it at 80%. On the major, they may say first year, we're only going to cover 20%. After that, we'll cover 50%. So they may not put a period of time to it, but they may discount actually the coverage and give you a reduced benefit for a certain period of time. And again, that's just the way insurance companies work, but I want you to make sure that you're aware of these different waiting periods. All right, now I want to talk about the best time to buy a dental plan. In other words, if you're really concerned about your oral health and you want dental insurance, we would recommend that when you come off of an employer plan where you had dental insurance, don't wait any more than 30, sometimes you can get by with 60, but definitely no more than 60 days before you get a standalone dental plan, because if we prove to the insurance company that you've had an employer plan or an individual plan, what they'll often do is they will waive these waiting periods and they give you good coverage immediately. So the best time to buy it, within that 30 to 60 days. And again, some companies only give you 30 days when coming off a group plan, others will give you 60 days. But you wait beyond that, now all of a sudden now we may be subject to waiting periods. So the point is the best time to buy that is certainly if you want to plan, do it very quickly once you go on Medicare. Now I do want to go back and just talk about something real quickly. When we talk about the coverage in these different types of services, again, let's say that I don't have a waiting period, I've had a group plan, I'm going to go on immediately. What normally happens here is your basic service is covered at 80-20 and sometimes 90-10. And what I mean by that, if I go in for an extraction or a filling or something very cheap, it means the plan's going to pay 80% or 90%. I'm responsible for this. And that my part, this part that I'm responsible for now, then what's going to happen is that's my out-of-pocket expense. Now, when it comes to basic, almost always they're going to be 50-50, all right? And so 50% covered by the plan, but you're going to be responsible for 50%. So you go in for root canals, $1,500. That's a major service. You pay $750. The plan pays $750. So any kind of an expensive service, it will be just split 50-50. So what you want to pay attention to when we get one of these plans is this company will spend 50% on major, 80% or 90% here, but what's the maximum benefit on an annual basis? And that really is a big deal. You want to pay attention because some plans, their maximum annual benefit is about $1,500. We write some plans that are as high as $3,000. And sometimes there isn't any more than maybe $20, $25 a month difference in this annual max out of pocket. So yes, I'm paying attention to all these variables, but I also want to make sure that when I see that company, what are they going to pay for me? $1,500 to $3,000 a year. And also some of the plans, they include cleanings in here and some do not. We like it when a company is not including cleaning. So not only do we have our annual max here, then it would be plus our preventive services as well. So a couple cleanings, x-rays, or exam once a year. All right, so the point, these are things that you're looking at whenever you get a standalone dental plan. And again, you're gonna have a premium for it, but again, I think oral health is important. In fact, I have dental insurance. I have my whole family on dental insurance and we use it. And we feel like it really is a good investment for us. Then we're going to close with this, and that is this vision add-on. A lot of times the dental plans will also give you the option to add on some type of vision benefit. Now keep this in mind. If you just had Medicare A and B with a supplemental plan, you have wonderful vision coverage. Why? Because A and B and Medicare supplemental plans are going to cover glaucoma, cataracts, macular degeneration. I mean, they have wonderful coverage for vision and diseases of the eye and all those kind of things. But the one thing Medicare does not cover would be eyewear, unless it's after cataract surgery. So it doesn't cover eyewear, and it doesn't cover exams for eyewear, which would be like a preventive exam. You go in to see, do I need an upgraded prescription? How are my eyes doing? Medicare doesn't pay for that. So no eyewear or exams for eyewear not covered by Medicare. So when you get a vision add-on, that's what that company is willing to cover. In other words, they usually give you one eye exam free a year, since Medicare does it, and they're going to give you some kind of a coverage for contacts and for lenses and glasses and those kind of things. And so you just got to read the fine print to see what they'll actually cover. And again, the vision add-ons are normally very low cost. I think right now, if someone has an iMed network, it's normally about a $10 a month add-on, and you do VSP network, a little bit more comprehensive, maybe about a $16 a month add-on. So you can add that typically to most dental plans. They'll give you the vision option as well. So I just want to mention it because we see about half all people that we write plans for are going to do some kind of a vision add-on because they'd like to have those glasses, eyewear, contacts, and an eye exam covered by the plan. All right, so those are the details, and so be sure to pay attention. As we always say, be sure to compare plans, read the fine print, and then enroll in the best coverage for you.